Laboratory medicine in Africa today is stronger than ever before. However, Africa has been experiencing a number of new and emerging infections and other health challenges against limited and overstretched diagnostic capacity.
There is population growth, global warming, migration, and changes in lifestyle that affect disease burden. It puts a lot of pressure on our healthcare system and especially the laboratory system to detect health threats and to provide correct diagnostic.
There are some areas in the continent where labs have moved further along, but we still have labs in Africa where even the basic microbiology is still a challenge.
In Sub-Saharan Africa, there's a particular lack of diagnostics available. We did a survey of national plans in various countries, and we found that very few mention diagnostics at all.
But then we still have challenges on implementation of national laboratory policies in countries that have policy. We still have silos in terms of programs.
Another key weakness is the lack of referral linkages that enable the broader use of all diagnostics and capacity that is available across the entire lab network, as well as weak supply chain systems.
The proportion of trained individuals relative to population size is vastly inferior to what is required and to what is currently in place in the higher income countries.
A lot of effort has been made to strengthen laboratory system and improve the delivery of diagnostic on the continent.
There has been a big push for some innovations, new technologies, and also the genomic sequencing that has proved to be a powerful tool in detecting diseases.
Diagnostic innovation is an area that can benefit most of African countries, especially with the current multiplex technology that help us to address several areas like the human resource needs.
Multiplex molecular platforms enable us to test multiple analytes from a single sample. This will help us to reduce on tests that are required, enable us to deliver diagnostic services everywhere where we encounter patients, and also reduce on resources required in the delivery of services.
There are opportunities to take advantage of new technologies such as AI, machine learning, other computational methods that will enable laboratory scientists, clinicians, community health workers, etc., to do more with less.
ASLM has been instrumental in supporting the changes through provision of technical assistance to train the human resources to gain competency, but also keeping us updated of the new guidelines and innovations that are coming on board.
ASLM represents the voice of the African laboratory community and is at the forefront of moving laboratory and diagnostic testing into the future. We have recently launched a new 5-year strategy to better respond and address continental challenges effectively.
We work around 4 important pillars: improving the laboratory workforce, ensuring access to diagnostic, increasing the efficiency and effectiveness of laboratory network and system, and empowering the laboratory community in Africa.
We will be using our programs such as we have the ASLM Academy that is addressing training needs. ASLM will improve the quality of diagnostics using the One Health approach.
ASLM has also spearheaded strengthening laboratory processes towards accreditation through the SLIPTA program, which has had results in moving labs significantly towards accreditation.
Under the Mapping Antimicrobial Resistance and Antimicrobial Use Partnership MAP, we have worked with scientists, researchers, national authority, healthcare providers in order to collect, analyze, and interpret very important data on antimicrobial resistance in Africa. And this data has been packaged to inform national action plan for the containment of AMR.
ASLM is going to address the workforce challenges in a sustainable and country-owned way.
We are also gathering information on the functionality and the capacity of laboratory system and network using the LabNet scorecard or the lab mapping, which collects information that is geolocated on the capacity of laboratories. That can be used for diagnostic network optimization.
Since 2011, when ASLM was established, there has been a very, very strong alignment with the PEPFAR activities. All these systems that PEPFAR has developed over the years are now being integrated, and we work together with ASLM to ensure that they are used to be very, very impactful and supporting the continental agenda.
The ASLM initiatives and approaches align very well with Global Fund strategies to strengthen lab systems. With ASLM, African leaders have been challenged to really work on innovations, expand and scale up best practices, and provide solutions to Africa's problems.
We cannot achieve our goals alone, so strong partnerships are essential.
We partner with countries, with associations, with laboratory workers and agencies such as Africa CDC or the WHO. By doing so, we can match the technical innovation that are out there with the country demands, with the funding.
I'm excited about working with our partners on the African continent, particularly the African Society for Laboratory Medicine. The work that we have done to build learning networks such as the LabCop, which is a community of practice focused on laboratory strengthening.
ASLM remains one of the highly valued Pan-African organizations that Africa CDC collaborates with. An organization that is people-centric and develops context-specific interventions that countries can benefit from. This is the Africa we want.
The future of laboratory medicine in Africa is brighter than ever before, and I'm very optimistic in ASLM leading the way in the 21st century of laboratory medicine.
We are working with an incredible community of laboratory professionals, scientists, researchers, civil society, policymakers. They are all supporting ASLM to find African solutions to African problems through African creativity and science.
We are so excited to be working together to change the future of diagnostics in Africa.